is going to kick us off.
Hello, good afternoon, welcome. Hopefully everyone can hear. Thank you so much for coming today. I'm Joy Johnson, and I am the Executive Director of Burton Bell Car Development Corporation by day. Um, and also by day, I serve as the chair of the Council of Agency Executives. And I'm here to welcome you to an information session around the Human Services Chamber of Commerce. So if you would, I don't know if the chat allows us to do that, but just put your name and organization in the chat so we know who we have in the Zoom room. So just to give you a little bit of overview of what we're going to be doing today, if we can look at the agenda, one, you're going to have a welcome by me, which is where we are. We're going to hear from the incomparable John Corlett from the Center for Community Solutions to say how we got here to the point where we feel like we need a human services chamber. Melissa's going to talk about what human services provides to the land, no pun intended, in Cleveland. But what the context is, Colleen Cotter, and I'm sorry, Melissa Graves is uh, the president and CEO of Journeys Center for Safety and Healing. Did I get it right? Okay, phew, all right. And Colleen Cotter, who is the head of Legal Aid of Greater Cleveland, is going to talk about what value the Human Services Chamber will bring. And then I'll come back towards the end, facilitate a discussion, answer any questions, and then talk about next steps. So I guess if we just go over to the overview, I feel like I'm talking a little bit fast, but what is a human services chamber? You may have seen the emails, you may, heard us talk about it. We have Greater Cleveland Partnership, which is a chamber of commerce for for-profit businesses, but many metropolitan areas and rural areas have a human services chamber of commerce for nonprofit organizations. To have a collective voice and be able to advocate for issues and causes that impact all of the human services field. So whether you're working with youth, whether you're working with unhoused, whether you're working with domestic violence, whether you're working with residents, empowering them to take on their own communities. There are certain common needs that we all have, and there are certain common opportunities that we could take advantage of if we were unified. So that's what you're going to hear more about today. I look forward to hearing from my colleagues and then hearing from you. I was going to turn it over to Melissa, but I have one more slide because you're like, it couldn't just be this Joy Johnson lady that's doing all of this stuff. We've got an entire team of folks who have volunteered to really do some of the legwork, explore the feasibility, and really just flesh out what this could look like for Greater Cleveland. And the list is here in alphabetical order. I won't read them all to you, but there are names that you all recognize from the community. Some folks are newer in their roles. Some folks have been in the nonprofit field for a long time. Everybody brings a different level of expertise. And we've had really robust and productive working sessions to get us to the point where we are today. So if you know any of these folks, please just thank them. And also feel free to ask them any questions that may not get answered here today. They are serving as ambassadors for this effort. So we haven't been doing this in a vacuum. We've been doing it alongside our peers. So next, I'm going to turn it over to John to talk about how we got here.
Thanks, Joy. And I want to thank you and Colleen and Melissa for really sort of jumping on this issue. We would not have gotten this far without your help. So I want to say thanks to all of you, and thanks to all the other nonprofit human service leaders who kind of added their wisdom and insight to this process. But I think, how we got here first, I think many of us are just sort of frustrated by the lack of a broad human services, health services, nonprofit voice. And we also think that the community lacks an understanding of the importance of our sector. We're really critical. And I don't know that political leaders, even some philanthropic leaders, and the community really appreciates or understands the importance of what we do. We also saw successful examples of human service chambers operating in Franklin and Hamilton County, sort of in our backyard. And there's also one in Montgomery, nonprofit Montgomery. The one in Hamilton County is the oldest one in the state. Franklin County came next, and I think Montgomery came after that. But one of the things I point to, one of the things I learned about the Hamilton County Chamber was they were successful in persuading the city of Cincinnati to every year set aside a certain percentage of their general revenue fund to support health and human services. And that's really unusual for cities in this state. So early in 2022, Community Solutions retained a consultant to kind of measure interest in and the feasibility of a health and human services chamber in Cuyahoga County. We interviewed 31 people, 31 leaders, and we then collected surveys from 46 other organizations. And what we found was there was strong support and interest in a human services chamber, particularly one that was focused on advocacy, taking our message and our voice to our political leadership, as well as providing networking and collaboration activities for human services leaders. One of the comments we got was particularly for maybe newer leaders, people who are sort of moving into the sector and sort of need that support from their peers as we all deal with a lot of common issues. And then the other thing was that a responder said that a human services chamber shouldn't be headquartered within a funder, that it should be independent and have that independent voice. And so that was another message. We also, I think, heard pretty strongly that we shouldn't duplicate services offered by others. If there's other groups out there that are already doing things or already adding value to our sector, we don't want to duplicate that. We want to add value to what's already happening. And then we also said that Community Solutions would work to help secure some startup funding so that we could get this group off the ground. So I'm going to stop here and advance. And the other thing I should say too is if you have questions, you could either enter them in the question box, and we'll come to those at the end, or in the chat box. We've got someone sort of monitoring both, and they'll bring that to us to look at. So let me move forward here.
Am I still here?
You are still here. We can hear you.
All right. All
Yes.
right. Excellent. All right. So thanks, John. As John mentioned, that this human services concept has evolved partially out of what is currently the United Way's Council of Agency Executives, which has been an association of executive directors of United Way funded organizations. As we all know, in the past years, the United Way has been transitioning its funding model. This is largely part of a trend affecting United Ways across the country, where we have fewer employees participating in traditional workplace giving campaigns. So the United Way has adapted its grant making by going deeper on focused areas addressing poverty, and resulting in fewer organizations being funded. So where do we go as nonprofit executives and leadership to come together to learn and to leverage in an independent forum that doesn't have that same dynamic of funder and grantees? The CAE has continued to meet during this transition period. And as Joy and John mentioned, that group of volunteers serving as the HSC steering committee and really working off of that feasibility study. As the HSC launches, the CAE will sunset. It will go away. We've been in communication with the United Way. The United Way is supportive of this direction. They have offered to partner in ways where they can add value to the sector. For example, making training resources that are available through the Centers for Excellence available to all HSC members, collaborating on our policy agendas where they are aligned, having HSC representation on the United Way board to facilitate that communication and partnership, and the United Way participating in HSC especially as a way to leverage 211, which is a program that supports all of our work. We anticipate this transition to be completed by the end of 2023. And so that's kind of that context. Then next slide, I just want to share a bit of what our sector looks like in Cuyahoga County. John mentioned that collective impact that we have that we feel is not always recognized or mobilized. There are nearly 6,000 nonprofit organizations in our county, with the largest sector of those being health and human services. We employ over 115,000 people, generate over 14 billion in revenue, and represent approximately 16% of the county's GDP. Colleen's going to go into a little bit more depth about the value of what we can do together and some of the feedback we got in the feasibility study, but I wanted to just underscore and highlight what an opportunity this is for equity. Cuyahoga County, we've declared racism as a public health crisis. Our collective voice and expertise really offers an opportunity to advocate for equity in our county and within our own sector. Human service organizations have more diversity and representation in executive leadership than in the nonprofit sector as a whole. You see that number, 57% of executive directors are BIPOC, 43% are white-led, compared to in the entire nonprofit community, you've got 39 BIPOC leaders and 61 white. However, that disparities exist within our sector, with white senior leadership salaries averaging higher than Black senior leadership salaries. And overall, interesting, the salaries of staff in Black-led orgs are higher than in white-led orgs. So those are just interesting dynamics for us to be looking at within our sector. And then one thing that we've talked about a lot, and we're all, just really aware of, is that human services compensation is 15% lower than the entire county nonprofit sector. It disproportionately affecting women and BIPOC individuals because there's such a high number in our sector. And that's comparing to other nonprofits, not comparing to the public or to the private sector, right? The median wage in our sector is $10.38, which is barely over minimum wage and far less than the $15 to $20 hourly wage that's estimated to be a livable wage. Many our organizations exist to serve individuals with low incomes, individuals striving to strengthen, and a majority of our staff within our orgs themselves may be considered low income. So it's really an opportunity for us as a sector to do work within our sector and advocate in our county. I am going to turn it over to Colleen.
All right, thank you, Melissa. So I'm going to talk about what is the value proposition. And the reason that this is really important is, one of the reasons, is that in order for a human services chamber to be successful, two things will need to happen. We all have to see this as ours. This isn't over there. This is an entity that belongs to us collectively. And as such, we're all going to be asked to pony up. There will be a dues structure so that we all, buy into the membership, and hopefully there will be other resources also available. But if we're going to ask for people to pay a membership dues, obviously folks have to believe that it's valuable and that there's a return on that. So the theme here is that the Human Services Chamber will sustain and grow our industry, and that together we are stronger. So there's 4 areas I'm going to talk about. I probably could talk about 25 areas, and you all could think of your own value proposition, which is terrific, and one of the things we want to discuss when we get to the conversation part. But the 4 things I'm going to talk about are advocate, transform, support, and collaborate. So John and Melissa and Joy all mentioned the first one already because it's so obvious. Advocate. We are powerful organizations. We are powerful individuals as leaders of our organizations. We have powerful boards. But because we're not well coordinated and connected, we lack the power as an industry. So coming together, we can set priorities and advocate as a whole to support that growth and sustainability for our organization. So John mentioned funding in Franklin County that the Human Services Chamber got together and advocated for as a whole. So advocating for our organizations to grow and to sustain that growth. Also advocating for issues that impact our clients, policy issues within Cuyahoga County and at the state level, no doubt in collaboration with other organizations like our Human Services Chamber to improve the lives of our clients. Advocating for funding and legislative changes and regulatory changes, all of those as examples of the things that we would advocate for. And we've all probably participated in different realms and advocacy days. And you can sort of see, you know, when you're down at the State House and you see a large group of people who are all connected and speaking from the same, you know, hymn book, it's really powerful for those legislators to see, wow, these are a lot of folks and they're all saying the same thing and they're coming from slightly different directions, but they're advocating for the same thing. And doing that at the local level, which is amazing that we haven't done this, right? In some ways, like county council is right there and we all interact with them. City council is right there and there are many city councils and we all interact with them, but we don't do that in a collaborative, focused way. So that's the first thing. And honestly, for me, I'm done. I don't need any other value to come out of the Human Services Chamber to convince me that it's worth doing. But there's more. And so the next thing is about, it's connected to the advocacy, is building really transformative relationships with decision makers. I feel like in some ways, sitting in my seat, and I suspect others feel this way too, that decision makers see us as like, oh, the poor stepchild, or, you know, oh, they need a handout. And isn't Colleen, she's so cute, you know, when she comes and she wants something for her clients and she wants money. And, you know, I hate that. Could you tell? I hate that. So building, you know, it being this strategic, deliberative, you know, we're going to be there over and over and over, raising our stature with decision makers, things like planning events with, you know, that elected officials and other stakeholders want to come to and are incentivized to come to. That sounded like maybe it was something illegal, not incentivized in any illegal way, but they see the value we bring as a community. So they want to come hear us, and really building over time those transformative relationships. So it isn't about a handout. It's about how can we together, the Human Services Chamber with other decision makers in our community, come together to move the community forward, and building our capacity to tell our story and to tell it in a broad way. Again, it's not about any of our individual organizations, it's about the collective. So telling that story again and again and again, and over time having a communications plan so that we can amplify each other, you know, and our communications at Legal Aid and at Burton Bell Carr, picking up on the messaging from the Human Services Chambers so that people are hearing it from many directions, slightly different voice because we all have different voices, but amplifying each other. And so those are the sort of big picture external values that I think are top of mind for me that the Human Services Chamber would bring. And then the last two are about us. And so supporting each other and collaborating. We all know, those of us who are CEOs in our organizations, we know that these are hard jobs. These are often lonely jobs. And they're hard and they're lonely. And so building a place that isn't funder focused, it's not convened by a funder, that's ours, where we can support each other and learn from each other. And that means from very sort of informal opportunities to also training that's just focused on us, building our community for sustainability, and also for building up other leaders in our organizations to step into our shoes as we move on to other things. So really creating that culture of a strong human services community that supports each other, is connected with each other, and learns from each other, bringing in speakers, et cetera, but also learning from each other. And then just through that, I think will come collaboration. The more we're together and learning about our organizations and strengths and needs of our organizations, the more we'll be able to identify where should we be working together, both in terms of serving our clients, how can we leverage the skills that we bring to serve our client communities, but also, you know, in back office collaboration opportunities to share, to pool resources and do something amazing in making our organizations stronger and more effective, more efficient, and also in things like piloting new programs that could be a model for other programs, and then sharing that model with each other, and maybe pooling resources to engage researchers to study a particular issue, challenge, or solution that we can share with each other. These can, you know, often be so valuable, but often expensive to do on our own. So coming together and again, seeing the overlap and the complementary services and work that we do. So I'm going to wrap up there. But before I pass it on to Joy, just want to come back to the idea that we are stronger together. And that's what this is about. It's about, we're not in competition. We're not trying to impress anybody because there's nobody in the room to impress. We're just together and we can really be our authentic selves and make for a stronger community. Joy?
Thank you, Colleen. And I don't know if everyone saw in the chat that this was Colleen's brainchild. She was the outgoing chair of the Council of Agency Executives as Melissa and I were incoming, and it was something that she had started and she asked if we would continue. I can't even remember how John got involved, but John's always involved in everything. That's why we're going to miss him. But so I really want to thank Colleen for her vision and her leadership and encouraging us to explore this. So I see that Colleen talked a lot about what we heard in the feasibility study. So just wanted to open it up to folks and ask, is anything missing? And I see lots of questions coming up in the chat. So what if we just start with those? Does that sound okay to you, John? How does the Margie Glick, thank you for including your question. How does the chambers ensure that small member organization have as much voice in deciding the chamber's advocacy priorities as the large member ones? I can tell you, Margie, that being a smaller nonprofit, that is something that is important to me. I know we've talked about as far as a dues structure goes, which is not your question, but to have a fee that slides based on the size of your organization's budget. And I imagine that we will have to collectively come up with a way to make sure that the big organizations don't cast a shadow over the smaller organizations. And so Colleen, Melissa, John, I don't know if you all want to add to that.
Yeah, I'll just add a couple of things. And on the dues, I think it does start with the dues, which is having a sliding scale and us all recognizing as a community that membership is membership. It doesn't matter what your membership due is. dues are. And we haven't sort of as a group settled on that. We're looking at the models that are out there, and no doubt it will change over time, but having a low enough starting membership due for a small organization that it really is accessible to every organization in the county. And again, membership is membership. So if Metro Health wants to join the Human Services Chamber, they would be welcome. And their dues would be significantly more than an organization that has 5 employees, but their membership would have no more value. So, when we get to voting on things, as we learned earlier this week, everybody gets a vote, right? And they will be heard. And 50% plus 1 wins the day.
And I will say, oh, go ahead, Melissa.
Oh, I was just going to say, I think that the outreach and the recruitment is so important, that this is just broadly known to every size of organization throughout the organization, and that everybody has the opportunity to see that value in it. Because, larger Colleen talked about, we all have powerful boards, but do we? Right? Like there is, it's just making sure that we have enough voices at the table so that it's not just a handful of larger organizations dominating the space.
And I'll just, I don't know if we said this at the beginning, but to say that the group of us that have been working on this, we know that this isn't the finished product. It's just the beginning. And we got to a point where we wanted to open it up to the broader human services community in Northeast Ohio so that we could see what we're missing, invite more people to the table, and help us flesh these things out. So I'm going to pose a question back to you, Margie, and the rest of the group. What's an example of issue that might be important to a small nonprofit that might not matter to a big nonprofit? And then you can just put your answers in the chat. It looks like we had another question brewing. Maybe someone is typing turnover. So yeah, so we had 2 key director level positions turnover in probably 2 weeks. And one of those, someone who'd been here for 15 years, was one of those things you kind of understand. The other one was unexpected. So our leadership team is suddenly down, whatever that math is, from 5 to 3. And it does have a significant impact on just short-term day-to-day. We've got our recruitment plan. We've got a human resources consultant that we've hired, which I think this chamber could provide that kind of support going forward. But yes, the day-to-day is like, oh, who's going to lock up the office on Fridays? Because that's what Sharita used to do. So definitely agree that that's one of our challenges. I see Margie answered with ability to pay higher wages, provide strong benefits. That is also true. The 15-year vet that I lost is going to another larger nonprofit that's able to pay her more money. And I encourage it. I said, go, this is great. It's an opportunity for you. But yes, board development with the focus on talent needed to help the organization. We were talking about that this morning, Beth, I don't know how to pronounce your last name, Darmstetter, I think, Darmstatter and I from Family Connections, that some organizations like Legal Aid, it's very clear to know what they do. And Colleen probably has folks beating down her door to be on the board. For folks like Burton Belcar Development, people think we're a law firm or a CPA. So even just them understanding what we do makes it harder and to recruit board members. You guys are giving great answers, and we'll definitely keep track of these. I never did see Mitch's question come through, so I'm going to keep reading some of these other answers.
Joy, if I could go
yeah.
back to
Mhm.
Margie's question or comment about ability to pay higher wages and provide strong benefits, I think that that is such a key issue, and Melissa highlighted the disparities in pay for nonprofits in the human services world, especially for people of color. And I think it's a good example of an area where having a human services chamber, I would hope, can focus on an issue like this by, for example, facilitating compensation studies to figure out what should we be paying, and putting a little pressure on each other in that sense, because in some ways it's about competition. Friendly competition in this, but that's, oh my gosh, I didn't realize that folks are paying this. And then also, and I think the more important thing is highlighting this issue with the broader community and with the funder community. Because if the funder community would say, you know what, we really don't want you to serve more people with this extra money, we want you to pay your staff more. And so we're fine if your numbers served or your outcomes go down, even though we've given you more money, because we know you need to, I mean, that would be really powerful, right? Well, I can't accomplish that. And Joy can't accomplish that, but perhaps the Human Services Chamber with a plan could actually get the funder community on board to help us pay folks more.
Thank you, Colleen, for that answer. Health insurance, I think, is another one that I know for us takes up a large portion of our budget, but it's important because we want to make sure our employees have quality health insurance. But I feel like there are some cost savings opportunity there. And Julie, I see your quote. We want you to pay your staff a living wage. Yes, we want to pay our staff a living wage too. It's something that we share. Any other questions, comments? I'm seeing Beth's second comment about, yes, folks want to lump us in all together. And I guess we are folks, because here we are trying to lump us in all together. But what I'm hearing is that we definitely need to pay attention to how we differentiate between staff size and budget. Maybe there are services tailored to small to mid-size, maybe we come up with some sort of range, and then some things might be overall. And there may be opportunity for mentoring and such.
Yeah, and Melanie Hogan's comment about other HR aspects, I think that all of us recognize that this just becomes more and more and more important. The things that we have to worry about or should worry about in terms of supporting our staff are very different now than they were 20 years ago. And so joining together in addressing those things, I think could be so powerful, like, good onboarding and good training and other professional support. What's the best EAP? So many things that just having that forum for conversation. And maybe this is an issue, everybody needs XYZ, let's pool some resources and pay a consultant to develop a template that everybody could then use and make it those kinds of things that we could either out of just the budget or say to anybody who wants to opt into that and put in whatever amount of money to pool those resources could be really powerful.
This is John. The other thing I'm looking at the, when we did the feasibility study, I just want to reference some of the issues that people raised. I mean, we talked about the first one was around advocacy. The second is around, building those connections between all of us, between the leadership of these health and human service organizations. Another big one was around both budget advocacy, but understanding budget. So getting a better understanding of, the city and county budget and to the state budget, maybe to a lesser extent. But a lot of that, it's not always very transparent. I mean, the information's there and we can't just sort of send you to the web page. We got to provide some analysis and insight. That analysis piece came through too in the survey. And the other ones were around, Colleen mentioned some of this back office stuff. Like I think, raise your hand if you think your health insurance is going to go down this year for your organization. And then I want to talk to you and find out who you have your health insurance with. I'm just sort of guessing. I want to start a pool about how much it's going to go up. But there are things like that, purchasing, things like that we sort of do on our own. I've given the example. A few months ago, I needed to I was looking for a HR consultant, someone to help with some HR issues. And because we didn't have a full-time HR person at that point. And so I just sent an email out to everybody I knew in CAE and like, who do you use? Who do you know? So I got great advice back. I talked to some of those people and we found someone that way. But it'd be so much easier if there was just a way to do that where those ideas were posted. I could go and find them and didn't have to send emails all the time to people. Some of the, all the other issue that came up, this would be probably more specific to some groups, is, advice around contracting. A lot of us contract with public agencies or with Medicaid managed care companies and things like that. So advice about that, thinking about that, the sort of the collective wisdom that could come from all of us working together. But those are just examples of some of the things, that people raise. And each of those was brought up, anywhere from by 30% to 40% of the people that we talked to.
Thank you, John, for covering that, because I was supposed to cover that in my section. And it's like, oh, I never did grab that. So thank you for that. Thank you for that. And I see more ideas are coming in through the chat. If someone would tell me how we're doing on time, just after hearing John's the list of the priorities, does any of that resonate with you? Is there anything missing? And is anything on that list that shouldn't be there?
I see somebody mentioning like technology, all of us probably use some sort of IT or internet firm, unless we're big enough to have our own director of IT. We're not that big. Those kind of things come up. I think, the other question that's coming up here is, and we can probably all sympathize with this, meeting fatigue. Are we creating another table that we have to be around and not taking any tables away? And I think that's a fair question. And, one of the ways I think to do that is, to run good meetings and, keep them short and have an agenda. But yeah, I mean, I think that's a good point. And one of the things I think we'd want to do is as this group comes together, is maybe talk to all the other sort of coalitions in town. There are coalitions around various interests and things like that, and see where we can, maybe combine forces on things so that we're not all sort of covering the same thing in different meetings. So,
And I think Colleen covered this too, but just knowing what resources that exist currently. So I see a lot of references for board member recruitment, board engagement, and we have representatives from Business Volunteers Unlimited on the call who provide that service and have provided it for us at Burton Bell Carr. And I'm still using, I didn't meet the timeline that they gave me, but they gave us step by step for the board. And it has made my board meetings so much easier since we worked with them in late 2021. So shout out to BVU. So I think I would encourage you now, as you read this, if you see an answer to a question that somebody presented and you know the answer to it, include it. Let's start the networking now. And Jordy, I really like your observation about how we connect frontline workers so that they can have a meaningful voice in the advocacy process. Both, I think, externally and internally as a human service network. They're the ones that know. I so appreciate it. They're on the ground. They're seeing it every day. I've been doing this work 20 years. Yes, since I was 15. And even though I think I have connections in the community, they're removed. I'm not on the front line anymore. I couldn't even work the copy machine the other day. I was ashamed of myself. And so I just imagine what I don't know and what folks are experiencing today that our frontline workers know. And it's so important for us to to be aware of. So Jordy, thank you for that input.
Yeah, and if I could comment on one thing I should have covered earlier, and that is a good example of what I think a human services chamber could bring to our community is there's been in the Plain Dealer a few articles about individual nonprofits going to county council and saying, look, the county owes us $1 million or $750,000 or $200,000. And we had to take out a loan to meet payroll because we don't have this money. And at least according to the stories, it looks like every time one of us does that, then the check is forthcoming, right? But that's, as we all know, I mean, kudos to those colleagues who've done that, because then that's risky, because we risk making the staff people who we work with all the time in the administration mad because we just showed them up, right? So you have to be, so kudos to those individuals. But the Human Services Chamber can take on things like that and give some cover to the rest of us. And so it's collectively gather the information about what are the issues that we're having with the county or with one of the cities in the county, and then have a strategy for addressing this and letting the rest of us support that, but not have to be out front. And also, it's great when it gets solved for an individual organization, but what about the other organizations that don't do that? So it's just one super tangible nuts and bolts example that I think could make a difference for a lot of us.
Thank you, Colleen. And thank you, Timothy. I see your point about membership. It has to be even across the board so that we don't perpetuate any inequalities. And Joy, thank you for asking that question, because that's a great segue into our next step slide. So if John could bring that back up, I can answer that question. Oh, Mitch, I love that centralized staffing pool. Yes, because we're small organizations, folks can only grow so far within us, and we want that knowledge to be shared. So, and I think that counters poaching, right? Where you're just looking up and a bigger nonprofit has snatched up your person, and you're like, oh, what do I do? So if there was some planning or transitioning that could happen. John, I'm sorry if I put you back on the spot and you're trying to work the slides. I can just read the next steps while he's getting that up there. So we're going to have another one of these info sessions. And John, if you want me to share, I can. Oh, there you go. We're going to have another one of these info sessions in September. So if there is somebody who may not be on the Zoom today and you feel like they would be interested in this conversation, please follow the Center for Community Solutions so that you can get the registration for info session number 2. If you came to this, you don't have to come to info session number 2. It's the same information. We're repeating it, but we will welcome you back if you like. And now until mid-November, we're ready to take on what we're going to call founding members. So we're doing an entry-level membership fee just to get started. And though the founding members can help us answer some of the questions that were presented here today and really put some I was going to say meat on the bones, but I have to find a different analogy around what we've come up with and really strengthen it. Once we get our founding members together, we want to let the public know. So we want to do a public launch mid-November. This is where we want to make sure elected officials, other chambers, other nonprofit leaders who may not have heard the word, that they hear that this is coming, and at that time we will announce who all are founding members. So you'll get a benefit of signing on as a founding member because your organization will be a part of the public launch. And Craig, I see your question and I wrote it down and I don't have that. So we'll get that for you in a second. Once we get our founding members and we let the world know that we've launched, we are going to work together. Now, keep in mind, right now, the Center for Community Solutions is our fiscal agent. And we know that they will be undergoing new leadership in early 2024 as John Corlett retires. So we want to be mindful of that. We want to make sure that we bring the new folks up to speed, and we hope to, have a seamless transition and support them in their role and continue to get their support of us. And so we put that tentative date around January, February 24. I'm sure we'll be hearing more information on what the center's timeline is for hiring. And then it's to be determined if this right now becomes its own separate nonprofit, or if it serves, as many other organizations have served, under the Center for Community Solutions with its fiscal agent, and its governance body would then continue to be a steering committee, or will it be a full board? At either rate, we will do the definition of that, as well as selecting folks to participate in that in early spring in 2024. And we have money to hire an executive director. And so we feel like with this timeline, we'll be ready to do that March 24th. So Joy, the goal right now is to have at minimum an executive director. We also talked about an opportunity for some fellowships that may be able to support an executive director early on, but that's our initial staffing goal. And to answer Craig's question, $75 for the low price of $75, you can become a founding member of the Human Services Chamber of Northeast Ohio. Don't give me the host job anymore, because I'm going to pretend like I'm a game show host. But yes, $75. So with that, are there any other questions? Anybody ready to sign up? Anybody wanted to thumbs down and say this is a bad idea? We're here for you. You won't hurt our feelings. Jordy, thank you for sharing that journal article link. And thank you, Jacqueline Salter. Sign us up. Thank you, Melissa. And I don't know what are our final next steps. If folks want to sign up today, John, what do they do? Just write out a check to Center for Community Solutions?
Yeah, they could do that. We'll send something out to everybody from the call. We'll post a recording of this online, and we'll get everybody the details. I think we've set up a special email address for the chamber, so it'll have its own email address as well. So, but I think otherwise we can let people return to their day.
I do have a technical question. I know we can get a copy of the recording. Will the chat be a part of that copy? Because there's some good info there.
Yeah, I think so. I think I'll ask Ebony about that. I'm sure we save all that.
Okay.
Yeah.
All right.
I agree.
Thank you. Thank you all for your time, and please spread the word. And thank you, Melissa, Colleen, and John.
Bye, everybody. Thank
Bye.
you.